Got cysts? Got fibroids? Is your gynecologist telling you that you need to have a hysterectomy? Are you seriously considering going through with it? Well, stop. Give us just a few moments of your time, and we'll expose a most sinister underlying motive that your trusted doctors will never share with you. Ready? Okay. Let's go. The United States performs more hysterectomies than any other country in the world. This means there are over 600,000 hysterectomies performed in the United States each year. At least 300,000 out of those 600,000 hysterectomies are due to uterine fibroids. 78% of all hysterectomies are performed on African American women. I don't think you heard me. 78% of 600,000. That's an astounding 468,000 African American hysterectomies per year, and 234,000 of them are due to fibroids. Now, according to a report published by Obstetrics and Gynecology, 75% of hysterectomies do not follow the ACOG guidelines, meaning 75% of the hysterectomy surgeries were unnecessary. So what are those clandestine motives? Well, first, we'll just give you the facts. Hysterectomies cost U.S. patients over $5 billion per year just for the procedure. An additional $5 billion is spent annually on the hormone therapy following the surgery. Hormone therapy has been conclusively proven to cause breast and ovarian cancer. Numbers never lie, so let's do some quick math. $5 billion per year on the hysterectomy procedure. 78% is spent by African American women. That's 78% of $5 billion, which equals $3.9 billion. Now, there being 468,000 African American hysterectomies per year, that's $3.9 billion divided by 468,000, and drum roll please, that's $8,000 on the average per hysterectomy. And let's not forget the ongoing post-surgical hormone therapy, which will cost an additional $8,000 per year. Our young women visit their physicians with complaints about cramps, heavy bleeding during menses. These are the two most common and early symptoms of fibroids. 95% of patients with these symptoms are not tested to detect possible fibroids. A simple change in diet would eliminate the developing fibroids and save thousands of dollars, not to mention the impending pain and suffering. Instead, they are prescribed estrogen pills to regulate their cycles. This is problem number one. Fibroids absolutely thrive off of estrogen, and so develop into full-size mature tumors. At this stage, there are a few other options to a hysterectomy. A myomectomy is the surgical removal of just the fibroid, depending on their size and location. Unfortunately, not many gynecologists are skilled enough to perform this procedure and will recommend hysterectomy to save face. As a result, myomectomies cost more, the national minimum cost being $10,000. Another technique is uterine artery embolization, or UAE, also known as uterine fibroid embolization, or UFE. This is an interventional radiologist procedure that causes the blood supply feeding uterine fibroids to be cut off by the placement of very small polyvinyl balls into the uterine arteries. So the starved fibroid dies and shrinks. This procedure has its dangers and is seldomly offered, as gynecologists do not perform them and will lose the surgical fee involved. A normal hysterectomy or myomectomy with no complications can cost up to $42,000, according to a recent article published in the American Journal of Gynecologists. Authorities and gynecologists claim they still don't know the cause of fibroids. They claim they don't know how to prevent them. They claim they only know how to treat or surgically remove them. Do you get the picture? The good news is you don't need surgery. That's right. Surgery is not required to eliminate your fibroids or cysts, no matter what their size. Aboriginal Medical Association has identified the root causes of uterine fibroids through our unique etiological and diagnostic system of cosmobiology. The Aboriginal Medical Association has developed a female reproductive detox program that is totally non-intrusive and non-invasive. The Aboriginal Medical Association Cysts and Fibroids program will eliminate your unwanted uterine and ovarian growths in just 40 days. In just 40 days, without any incisions, without surgeries, without any complicated procedures, you could be completely free of your fibroids. Simply go to www.amahealth.org and click on the Help Me button. No more cramps, no more discomfort, no more heavy bleeding, suffering, just balanced and a more healthier you. Start eliminating your fibroids today. www.amahealth.org.